Mr. Ramatuba, thank you so much for your patience, and apologies that we couldn't have this conversation yesterday due to technical glitches. But let's get back to where we had started. This was with regards to the engagement you were telling me that you had personally with at least some of the representatives from the funeral sector. How did that engagement go?
Can you come again, please?
I wanted to ask how the engagement went. Just yesterday you were telling me about, how you did interact with some, representatives from various, funeral, industries and sectors. You did say some of them did not, meet with you. You met with only some of them. How did that engagement go with them?
Yeah, thank you very much, and thank you to the listeners. As you may have followed the news yesterday, there were quite a number of other undertakers associations that distanced themselves from the strike that was organized by the UTT and NAFUPA. But what we were saying yesterday was that since the outbreak started, we have been engaging with all the 13 undertakers associations which have organized themselves. We were engaging them through the organized structure which they have. Every time minister published the health directions to govern in terms of how management of human remains should be done, we always took them through each health direction to make sure that they understand what is expected of them, because we saw them as a critical stakeholder to prevent continuous spread of this disease.
Mr. Ramatuba, in as much as I hear you when you say that, other funeral undertakers had distanced themselves from the strike, I think it's quite important to note that even looking at the Mercury this very morning, they're leading with a story about how there are some funeral undertakers in the KZN province that are facing intimidation because they did not want to participate. So even though there are some that did not, unfortunately that could pose a risk to them. So with regards to then the demands that the UTT, amongst others, are tabling on the ground, what are you saying to them in response to their demands, so to avoid any further intimidation from either, homes or family members or even those other businesses that do not want to participate in the strike?
Yeah, thank you for that. I think from the health department point of view, there were three critical issues that needed to be addressed. The engagement that we had with NAFUPA before this strike, which I led one of the engagements that we had with their structures nationally. And then after my engagement and my team with them, my Director General also convened another engagement with them. In those engagements, there was only one aspect that was remaining. That was the aspect that has to do with them having to produce a certificate of competence when they collect human remains from the health facilities. I have updated in terms of this issue. I've engaged with the president of NAFUPA, which is one of the leading leaders in terms of the strike, that that particular requirement is not an enforceable requirement, because in terms of the regulations relating to the management of human remains, there is no provision where an undertaker is expected to produce a certificate of competence. What the legislation requires is that for an undertaker to operate, to process or to store human remains, they need to have a certificate of competence.
Right.
And that is something that cannot be compromised, because it is that certificate of competence that gives us comfort that environmental health practitioners will have inspected the premises and found it to be conducive for use, and it will not cause any unnecessary nuisance or risks to human health.
Right.
So that requirement is not an issue. So they are not expected to produce the certificate of competence when they go to the health facility.
So that's because of time, I have to ask you this, Mr. Ramatuba. Please, forgive me for this. But, I mean, that's in as far as conversations are concerned between yourselves and, the sector. When we bring it down to the ordinary South Africans, which are mostly and directly affected by the strike, I mean, unfortunately, during this time, some of them are planning to bury their loved ones. Some of them are planning to, collect human remains from mortuaries or to even deal with funeral parlors. How are you dealing or assisting families at this time who are probably even frustrated that their loved ones at this particular time cannot be assisted? And in the same breath, yourselves as the Department of Health, obviously in private and public hospitals, probably having a backlog of human remains, having to move from one point to another.
Yeah, it's a complex one because the way South Africa's management of human remains it's structured. The country is dependent on undertakers to be able to collect human remains, and we were hopeful that those undertakers that are not participating will be able to assist in relieving the pressures in the health facilities, because indeed the piling of the human remains does cause quite a health risk, both to the health officials that are in those facilities, as well as to the members of the public that may be exposed. And unfortunately, we are not in the position to say we can assist in removing these human remains to go and bury. You may also know that the government does have the forensic pathology services, but that service is already on its own overwhelmed, and it's focusing on crime, on addressing the issues of crime that are related to the deaths of the individuals that manage. So it's not a system that we say we can use to relieve the health facilities. But we're hoping that because all the issues that has to do with health has been addressed and has been addressed, and the Undertakers Association are aware of that. We have informed verbally in the teleconference. We have informed the leaders of the strike that there is nothing else that has to do with health. And I noted that they also reflected the same thing in the news in the evening, that there is nothing more that has to do with health. Anything that remains is the issues that Home Affairs and other stakeholders should be able to address with the UTT.
I appreciate your time this morning. Thank you so much, Mr. Murdoch Ramathoba from the Health Department. Thank you so much for your time.